Hello, it's Dr. Rhonda Johnson. Today is Thursday, December 14th, 2023. Today I'm talking about an anthrax outbreak in East and Southern Africa. While the World Health Organization released earlier in the week that Zambia, Kenya, Malawi, Uganda, and Zimbabwe are experiencing anthrax outbreaks. So far, there have been more than 1,100 reported cases and 20 deaths this year. Now, Zambia is seeing the most cases with 684 suspected and 25 confirmed cases and 4 deaths. Now, human cases have been reported in 9 out of 10 Zambia provinces, and in one province, 26 people contracted anthrax by eating the disease from a contaminated hippo. So what is going on? Well, the World Health Organization says the recent uptick in cases is caused by a number of factors, including climate change, food insecurity, and a low understanding of how the disease is spread and who's at risk. So what is anthrax? Well, it's a bacterial infection, folks, not a virus, a bacteria caused by a bacteria called Bacillus anthracis. It's a serious infection. It occurs naturally in soil. It commonly affects domestic and wild animals around the world. What happens is that the bacteria produces these spores, which are inactive, dormant spores, but they can live in soil for decades and decades. And then all of a sudden the climate gets right, the right temperature, the right water, the right nutrients, and the spores get activated and they start growing. And then the animals ingest it, like the sheep, the cattle, and the goats, and it produces the bacteria that multiply in their bodies. They cause toxins, which are poison, and the animal can get sick and die. Now, there are different types of anthrax. The cutaneous, which means skin, which is the most common. Inhalation, which is the most deadly. Gastrointestinal, when you eat infected meat, and that's undercooked, and it can be fatal if not treated. And now there's a new form, injectable, that is showing up with IV drug abusers in Northern Europe. Now, how do you get anthrax? Well, if you come in contact with infected animals, that's how you get it. And it's important to know that it's not contagious. It's not like the flu or COVID or, a gastrointestinal diarrhea type illness. You cannot pass it from another person like the cold or the flu. So the people who are most at risk are the people who are farmers, livestock owners, people who handle animal carcasses, especially the cows, the sheep, and the goats. So most people will never be exposed to anthrax. So please don't listen to my video and think, oh, here comes something else. Folks, calm down. It's not, you need to know about anthrax. I share this because I think it's important to have a knowledge of what goes on in the world, because we are part of a global community. And, most doctors in the United States have rarely, if ever, seen a case of anthrax. I know that I haven't. So that's my message today. I'm sharing for general information only. And most of my information came from the CDC website, so I'll include the link. Take care, folks. Be well. And until next time.